my name is Dana Vorrath, and I'm going to be your nurse practitioner seeing you today. How are you?
Good.
What's your name?
Sandy.
What's your last name?
Vorrath.
And when is your date of birth?
12/18/65.
Nice to meet you. What brings you in today?
I have a really, really bad sore throat, and I've had a kind of a higher fever.
When did it start?
It started this morning, but it's like progressively getting worse.
0 to 10, 10 being the worst. How do you rate your throat pain?
It's a 10.
And then what does the throat pain feel like?
Like I'm swallowing shards of glass. It just hurts really bad.
Okay. And then how do you describe the pain? What does it feel like?
Like it just burns really bad, and it's really painful.
Is there anything that makes it better or worse?
I can't swallow like food. That makes it worse.
Have you tried Tylenol or ibuprofen?
Yeah, I took some Tylenol earlier, but now it's worn off.
Did it help the pain and the fever when you took it?
A little bit.
How long did it help for?
Like 3 or 4 hours.
Okay. We're going to discuss your past medical history. Are you allergic to anything that you know of?
Mm-mm.
Okay. And then how about, are you taking any medications on a daily basis?
I take Prenavil, 20 milligrams, once a day.
And then what do you use that for?
Hypertension.
Do you feel like it's good, controlled well?
Yeah, it controls it if I'm on it, if I take it, yeah.
Do you take any other medications daily?
I just take an iron supplement.
What do you take that for?
Anemia.
Any other medications, including herbal or over-the-counter, that you're taking?
No.
Even as needed?
No.
Okay. And then, in terms of your social history, are you around anything in the environment that could aggravate your throat that you know of?
No.
Do you drink alcohol?
No.
Any recreational drug use, including marijuana?
No.
Are you a smoker?
No.
Have you ever been?
No.
Okay. And then, in terms of family history, do you have any family history like throat cancer or esophageal cancer, anything that could relate to the symptoms that you're presenting with today?
No.
Okay. And then I'm just going to ask you a series of questions just about some symptoms, just to get a better idea of what's going on today. Have you had any head pain?
No.
Headaches at all? Any fullness in the head?
Mm-mm.
Dizziness?
No.
Haven't noticed any masses or anything abnormal?
No.
How about with your vision? Any visual changes?
No.
Any tearing or anything? Redness in the eyes?
No.
Drainage?
No.
How about pain?
In the eyes?
Yes.
No.
Any nose pain at all?
No.
Any drainage coming from the nose at all?
No.
Okay. Any swelling that you've noticed?
Nope.
And then I know you said that your tonsils are back there, it hurt. Have you noticed that your tonsils are enlarged?
I mean, they look a little enlarged and they're really red, and I noticed like some white stuff back there earlier today.
Do you feel like you're breathing okay?
Mm-hmm.
Any problems swallowing?
Mm-hmm.
I know you said it hurt to swallow.
Yeah, it hurts to swallow.
Okay. And then have you noticed any masses or anything in your neck? Anything that feels different?
Mm-hmm.
Okay. All right, we're just going to go ahead and do our physical assessment, and I'll guide you through every step of the way. So first, I am just going to observe and inspect your head for symmetry, looking for any obvious deformities, any masses, and I don't see anything like that. I'm going to inspect your hair for condition, texture, and it looks really good. I'm palpating it as well for condition and texture, and it feels good. It's pretty evenly distributed throughout, and it's good color. I think you get some color. And then I'm going to inspect your hair for any manifestations or infestations, and I don't see any. I'm going to palpate your head. Do you have any pain when I'm palpating?
No.
I don't feel any masses or anything abnormal. Next, I'm going to inspect your face, and I'm looking at your face for its color. I'm looking at your face for symmetry. Everything does look symmetrical. I do not see any lesions, but I do see some acne scars, probably from a long time ago. So then, next I am going to assess your facial nerve, cranial nerve number 7. And what I need you to do for me is if you could smile, frown, puff out your cheeks. Show me your teeth. All right, I'm gonna have you close your eyes, and I want you to tell me where you feel this cotton ball. We're checking sensation.
Forehead, left cheek, right cheek, nose, chin.
Very good. And then we also assess the trigeminal nerve, cranial nerve 5, when we check for symmetry of your face, but I'm also going to check the motor component of this nerve, and we're going to check the TMJ. If you could open and then close, and open again, and close. I do feel a little bit of popping and some crepitations in through here. Do you ever have discomfort?
No, but it does pop sometimes when I chew.
I was going to say everything is
Like
intact.
a click.
There, yeah, I could feel it.
Yeah.
So next what I would like to do is I would like to inspect your eyes, and I'm looking at your eyebrows. They look evenly distributed. The color is good. They look symmetrical. I'm also looking at your eyelashes. They look symmetrical. They look very good. I'm going to have you close your eyes, and I'm going to inspect your lids. The lids look good, and I'm going to palpate the lacrimal apparatus above your lids right here. Any tenderness through there?
No.
And then I'm going to palpate your frontal sinuses right here. Tenderness at all?
No.
And then your maxillary sinuses. Any tenderness in through here?
No.
Let's see, all of that looks really good. And then I'm going to have you look at me so I can observe your sclera and your conjunctiva. Your sclera looks nice and white, and the conjunctiva is nice and pink. Your eyes are moist. And then I'm also going to look at your cornea, your irises, and your pupils. We're going to assess your pupillary response right now. If you're able just to look straight ahead for me, I'm going to shine a light into your eyes to be sure that your pupils constrict. I do. Very good. Now keep and just pick a spot on the wall, and I'm going to shine a light kind of in the middle of your forehead, and we're looking for the corneal light reflex, and we want to see that the light lands in the same spot on both eyes, and we're checking for strabismus or a lazy eye, which you don't seem to have. But just to be sure, we're going to do the cover uncover test, and I'm going to cover one of your eyes and keep fixated on the wall. When we remove this, your eye will have wandered, and it didn't. We're going to do the same thing with this eye. You're doing really good. No strabismus. And I did want to mention that when I assessed your pupils, they were equal round reactive to light into accommodation, which is a normal finding. With this, I do want to check your peripheral vision next using confrontation. So what we're going to do is I'm going to cover this eye, and you're going to cover this eye. And look straight ahead again, and I want you to tell me when you see my fingers coming into view, okay?
No. No.
And one more.
No.
All right, we're gonna switch. And tell me when.
No. No. No.
Very good. All right, we'll let our eyes readjust. I'm going to check and assess cranial nerves 3, 4, and 6, which are your extraocular eye movements. So what I want you to do is just watch my finger with just your eyes without moving your head. Very good. Cranial nerves are intact. Next, we're going to check your optic nerve, which is cranial nerve 2, and we do this by assessing your visual acuity. So I have an adult Snellen chart, and what I need is I'm going to mark off 20 steps, which is going to be about 20 feet from where you need to be. So if you will come over here for me and check your vision. Are you able to read this line starting from left to right?
EDFCZP.
Are you able to read the next line down?
FELOPZD.
And how about this one?
DEFPOTEC.
Your visual acuity is 20/20, and what that means is that you were able to see at 20 feet what the average person would be able to see at 20 feet, so your visual acuity was perfect. If you'll have a seat for me again. All right. The next thing we're gonna do is our ophthalmoscope exam. And I'm gonna use my right eye to your right eye. Look straight. I'm gonna come over on this side, left eye to your left eye. And what I'm envisioning here is I'm seeing your optic disc, the optic cup, the macula, and the vessels, which is especially important with you in hypertension, just to be sure that you don't have any microaneurysms or dot hemorrhages, and everything looks good in there.
Okay.
Not to scare you.
No.
So the next thing I want to do is I'm going to inspect your nose. I'm looking at the color, looking for any drainage. The nares look symmetrical. And then looking at the inner parts of the nose. And then I'm going to palpate your nose. Let me know if there's any tenderness in through here.
Nope.
All right, very good. I'm going to have you close your eyes and I'm going to ask you to identify an odor.
Cinnamon and pancake batter.
Yep. We've got a maple,
Yeah, that's
cinnamon,
it.
and pancake candles.
Syrup.
That was assessing cranial nerve 8, and it was intact. One thing that I had wanted you to do that we should have done earlier was when we assess your facial nerve is that we have to have you try something sweet and something salty to test the sensory aspect of that. So close your eyes for me. All right, here we go. Is it sweet or salty?
Salty.
All right. And then we're going to try another thing.
Sweet.
Yes, very good. Very, very good. All right. Next, we're going to inspect your ears. We're looking for symmetry. We're looking at the color. They look where they're supposed to be. They're not low set, so I don't think that we would be concerned about Down syndrome. Then I'm going to palpate the external ear. Any pain when I palpate?
No.
All right. I'm going to look in the auditory canal. Be sure there's no redness or inflammation. And I don't see any at all. Does it hurt when I pull back?
No.
All right. I'm going to go ahead and I'm going to do my otoscope exam. Any pain?
No.
All right. And I visualize your tympanic membrane. I don't see any bulges, any retractions or fluids, so no effusions. Coming out of this side, we're going to go look at this side. And looking in the canal, I don't see any redness, no inflammation. We're going to go and look in the ear now. Any pain?
No.
All right, and I do see your tympanic membrane. It's pearly gray. And then I also don't see that it's bulging, no retractions, no effusions. So now we're going to test cranial nerve number 8, which tests your hearing. I'm going to have you cover this ear, and I'm going to whisper 2 words to you, and I want you to repeat them back to me. Smile.
Smile.
Fun.
Fun.
Very good. Now we're going to do the other side. Hello.
Hello.
Friend.
Friend.
Very good. Now the next tests we're going to do are called the Weber and the Rhine test, and we'll first do the Weber. I'm going to strike this and I'm going to put this on your head, and I want you to tell me if you hear it equally in both ears or if it's heard better in one ear or the other.
Both ears?
Equal?
Yes.
That is a normal finding. So now I'm going to strike this. I'm going to put it on your mastoid bone right here. I want you to tell me when you stop hearing the sound, and then I'm going to put it by your ear, and then again you're going to tell me when you stop hearing it.
Now.
Right, and again.
Now.
All right, we're going to do the other side.
Now. Now.
Air conduction should be twice as long as the bone conduction, so that was good. The next thing that I would like to do is I would like to inspect your mouth. If you could open your mouth for me. I'm looking at the hard palate, the soft palate, the tonsils, and the posterior pharynx, and the tonsils are enlarged, they're red. It's red to the posterior pharynx. I do see some white exudate, but the tonsils don't appear so enlarged that you wouldn't be able to breathe. The tongue looks pink, it looks moist. I do see saliva, so you do look hydrated. I see that you have 1 molar missing. on the upper left side, and it looks like you have had some fillings, but otherwise dentition looks intact. No dentures, no bridges. And then right now we're going to test cranial nerve 12, and we're going to do this by having you move your tongue from side to side. Very good. And then next we're going to we're going to check out cranial nerve 9 and 10, and I'm going to have you say ah, ah. You would have a gag reflex, and then I'm also going to have you take a sip of water for me. Make sure you don't choke. Very good. All right, the next thing that I'm going to do is I'm going to inspect your neck. If you'll look up for me, and I'm just looking for color, for the trachea to be symmetrical and midline, and it does. I don't see any masses or lesions, scarring. I'm going to palpate the trachea next. Any tenderness in through here?
No.
Okay. Next, I'm going to palpate your thyroid. We're going to check to be sure that it's not enlarged. So I'm going to come behind you, and you're going to feel me push on the thyroid tissue and let me know if I hurt you. Any pain in through here?
No.
I'm going to push your other side. Can you swallow for me? Very good. It does not appear to be enlarged at all. I didn't feel any masses. So the next thing that I would like to do, and our final thing, is I would like to palpate your lymph nodes, especially since you have an infection. So first we're going to palpate the preauricular nodes. And let me know if there's tenderness. We've got the postauricular nodes, the occipital nodes, the anterior cervical nodes, posterior cervical nodes, and then the sternoclavicular nodes. Any pain? Very good. All right, the next thing that I would like to do is test your spinal accessory nerve. And actually, before we do this, if we could test your next range of motion. I'm going to have you turn your head from side to side, then up and down. Any pain?
No.
Now we're going to go against resistance. So push against my hand. All right, very good. Push against my hand. Push. Now I'm going to have you shrug your shoulders up and then come down. Very good. Spinal accessory nerve 11 is intact. Thank you. Thank you so much for your time. And I hope you feel better today.
Yeah, my sickness. You got gloves on, right?
I do have lots of gloves
Okay.
on. Yep.